Welcome to the Massachusetts General Hospital Frontal Temporal Disorders Unit Community Forum Friday, Session 9, Advocacy and Policy for Alzheimer's and Related Dementias. I am thrilled to be here today with community experts Dan Zotos and Chelsea Gordon from the Alzheimers Association. We're going to have a wonderful conversation today about the state of Alzheimer's policy, and also to talk about what are the advocacy efforts happening at the Alzheimer's Association, and how can you be a part of that, even during this time of pandemic when we're at home. I want to remind everyone that we're going to be recording today's session so that we can post it later on the MGH FTD Unit YouTube channel. And if you have questions throughout this session, you can enter them into the chat box or in the Q&A function at the bottom of your Zoom screen. My name is Katie Brandt. I'm the Director of Caregiver Support Services and Public Relations for the Massachusetts General Hospital Frontal Temporal Disorders Unit. And I'm thrilled today to introduce Dan Zotos. Dan is the Director of Public Policy and Advocacy for the Alzheimer's Association of Massachusetts and New Hampshire. Prior to joining the Alzheimer's Association, Dan was the Manager of Government Affairs and Advocacy at Demers and Blydesell, a leading public affairs and advocacy firm in New Hampshire, where Dan worked on a number of issues in the state legislature, including an Alzheimer's state plan. While in New Hampshire, Dan cut his teeth working in the state legislature, as well as the successful re-election campaign of U.S. Senator Jeanne Shaheen and Governor Maggie Hassan. Since joining the Alzheimer's Association, Dan has worked aggressively on all things dementia policy and was the architect behind Massachusetts' landmark 2018 state law, an act relative to Alzheimer's and related dementias in the Commonwealth. Dan, it's so nice to have you with us today.
Thanks a lot, Katie. Happy to be here. Hello, everyone. And on behalf of myself and everyone at the Alzheimer's Association, thanks for everything that you're doing right now during this time.
Of course. And we're also joined today by Chelsea Gordon. Chelsea currently serves as the Public Policy and Advocacy Associate for the Alzheimer's Association of Massachusetts and New Hampshire. Chelsea has experience as the Volunteer and Community Engagement Manager for the Home for Little Wanderers, a leading child welfare organization in Boston. While working at the Home for Little Wanderers, Chelsea launched their corporate partnership program, redesigned their volunteer program, and oversaw the largest holiday gift drive operation for families in need in the Boston area. Prior to that position, Chelsea was also working at the Massachusetts State House for the House Vice Chair on the Joint Committee on Healthcare Financing, and later the House Chair of the Joint Committee on Labor and Workforce Development. While at the State House, Chelsea managed constituent services and budget and legislative processes for the office, including research and drafting policy. Chelsea, welcome today.
Thank you so much. Thank you for having us.
Yeah. So as you guys can see, I have brought again two powerhouse experts in our community. And I just want to take a moment to say personally that I know these folks, and this is not just a job for them, but they hear your stories and they take that very personally and bring that passion to their work. So I think we're going to start this morning with Dan. You know, Dan, I think that one of the things when I'm working with families and tell them about even the work that I do through the FTD unit, where I'll do a lot of community education, but also advocacy. And many times families are not really sure, number one, what does it mean to provide advocacy, and like, how do you become an advocate? But two, who's doing that? Who's organizing it? What entity is providing that oversight? So maybe you could talk a little bit about how the Alzheimer's Association is spearheading that.
Yeah, absolutely, Katie. Thank you. And just to directly answer your question on, what it means to be an advocate, I can't tell you how many times I've heard in my time at the Alzheimer's Association over the past 4 years, families who have had really devastating stories say to me, I'm not political. I can't I can't do this. I don't know what this looks like. And through coaching with us, through, as you mentioned, really working with their story, and frankly, just sort of ripping the Band-Aid off when it comes to getting involved in the political and public policy process. Some of our best advocates have started with that statement to me and have gone on to testify before the state legislature, working with members of Congress, and have shared their story across the country as well. So it's amazing, sort of the small steps that really get someone so involved in this movement. We'll definitely speak more about what that exactly looks like. And Chelsea on our team really does a great job in managing our advocacy operations, sort of that grassroots work we do around Alzheimer's and dementia. And I just wanted to take a minute to mention, the Alzheimer's Association is the Alzheimer's and Related Disorders Association. So all the work we do encompasses other dementias as well. I just wanted to mention that at the jump. It's something I'm very sensitive to. And as mentioned, really appreciate the work you folks do.
Thank you. And whenever I talk to families, especially in large groups, I'm always reminding them, when you hear about, maybe it's a news briefing or that there was an increase in federal funding for Alzheimer's disease, they need to remember that the specific language in that is always Alzheimer's disease and related dementias, and that frontal temporal dementias, frontal temporal disorders, and those related conditions are included in that work.
Absolutely. Absolutely.
So, Dan, could you talk a little bit about what, I guess you think, what is the official role? Now, we know about the Alzheimer's Association as being an amazing support for families, providing education, support groups, organizing walks. But what is the Alzheimer's Association doing to support policy initiatives here in our home state of Massachusetts, but also at the federal level or national level?
Yeah, I'd say let's jump into it, Katie. I really do want to keep this a conversation as well. Chelsea and I did come prepared with a few slides.
Yeah.
If you don't mind, we'll throw those up just to have some visual behind the work we do. But I'd love to keep this conversational. Before I jump into this, I do just want to acknowledge, Katie, what you mentioned around care and support and the work we do. The Alzheimer's Association, even I'll say personally, my family has taken advantage of the services they offer in the community with our 24/7 helpline, our support groups and education is vital in terms of really getting that direct care and support to families. I did just want to mention, especially right now during this pandemic, we've been really focused on making sure families have the support they need, whether it be virtual support groups for loved ones for families who have a loved one in a nursing home, as well as our policy response to this as well. So I'll try to weave that into this conversation, but really wanted to mention that at the jump because I know it's top of mind for everyone. And this population is, of course, extremely vulnerable during this pandemic right now. So to jump into it, I think Chelsea shared the Alzheimer's prevalence and cost slide. This is something we typically used a lot when we present because I think it really demonstrates where we're headed when it comes to the financial implications of this disease, not to mention all of the personal stories and impact along the way there. But we're looking at $1.14 trillion cost to the US economy by mid-century, and currently costing the country nearly $300 billion when it comes to care in Alzheimer's and dementia. Now, especially right now during this pandemic, throwing big numbers around really doesn't mean much to me, frankly. It just seems like numbers on a paper. But as I mentioned, behind all this is a lot when it comes to what's truly an underlying public health crisis as we see it. But also, this has really proved to be an effective tool for us and our advocates and volunteers when we work with elected officials, whether it be on the state and federal level, to demonstrate the impact of this disease and dementia as a whole on our healthcare system. So just to, Katie, if I can just kind of set the table on policy on a federal level, and then definitely want to open up for questions on this with you. You know, where we currently are as a country, we've really come a long way. There was a bill in 2010 called the National Alzheimer's Project Act, which created a nationwide advisory council to really start addressing Alzheimer's disease as a country, as well as dementia. Katie, I know you serve on that council, so thank you for what you do.
I'm the co-chair, Dan. I love
Exactly.
it.
But all the good work and recommendations that have come out of that council since have really informed how we show up and the policies that we advocate for on the federal level, but also informing what we do on the state level. So I know Chelsea's moving on to this research funding slide. I think would be important to mention this right now. Alzheimer's disease research funding, we're really at an all-time high. If you look at this slide, you know, I started at the association around 2016 when we were just under 1 billion annually to research funding to the National Institutes of Health. We have really reached a crescendo, so to say, when it comes to working with our members of Congress and getting this done in a bipartisan manner. Before I forget, you'll see at the top right of the screen, the Alzheimer's Impact Movement. I just wanted to mention what that is. The Alzheimer's Impact Movement is a 501c4 sister organization of the Alzheimers Association. It's really the advocacy arm of the association, Katie, and that really gives us the opportunity to more effectively lobby down in Congress, but also really ramp up our grassroots efforts back in the district while working with members. Not to spend too much time on research funding, but I know this is vitally important to us, especially in this region. You know, as I said, we've really come a long way. This is really because of a two-pronged approach. The direct ability to lobby and advocate in Washington, D.C., you know, with our team at the association, the Alzheimer's Impact Movement, but also the grassroots work we do in the community all year long with our members, meeting them in their districts to talk about Alzheimer's disease and dementia, its impact on families, its burden on the healthcare system has really come a long way. Currently, even during this pandemic, this federal appropriations process continues. We are asking for an additional $354 million in research funding for fiscal year 2021. So the fight continues on research funding. This is money going right in the hands of researchers, and we really want to keep this momentum going, recognizing how far we've come.
So Dan, I have a quick story that I think has meaning related to what you just said. So Chelsea, if you push your cursor over to that 2015, 2016 year, right? So people may notice looking at the bar graph that there's a huge leap there. And so Dan, I know that was a banner year for a huge boost in funding and really started this upward trend. And it just so happened that 2015 was a year where I was an Alzheimer's advocate, and I went to Washington, D.C. for the Advocacy Day, you know, on Capitol Hill with the Alzheimer's Impact Movement. And we advocated for those additional funds. And then I came back and I was sitting in a lab meeting with the Frontal Temporal Disorders Unit, and our director, Dr. Brad Dickerson, said, oh, well, so since there's been additional appropriations, we've been informed that the NIH is able to fund additional grants. So some grants that we submitted that were not previously funded for primary progressive aphasia research will now receive funding. And I was sitting there at the lab meeting thinking, oh my gosh, I was a part of that advocacy group on the ground talking to elected officials. And now I'm sitting in a lab meeting and literally hearing the impact on scientists. Really incredible.
That is remarkable, Katie.
Yeah. Oh, I'm hearing, is anyone else hearing some music? I think that Jiro has brought them. There we go. Yes, it's all right to have a little music in the interim. We
That
like
was a
it.
good it was a good transition. But Katie, to your point, I mean, it's so demonstrative of the work we do in Washington D.C., but also, as I mentioned, back in the district and the impact it has. You know, I've heard similar anecdotes from folks we've worked with in terms of that funding coming directly to where folks live and the work they do. So it's vitally important.
Great. So thanks for letting me interject that story. I was just really blown away by that experience.
Yeah, absolutely. And you know, I'll say we have a few more slides, but I do want to just mention on this federal piece while we're on it, you know, that is sort of where we're at when it comes to Alzheimer's disease research funding from the federal government here in the United States. You know, the Alzheimer's Association is still focused on research in a really big way with what we fund and how we show up to the community. But the other side of this coin is the direct care priorities we work on. I'd like to spend a little time talking about that. Katie, I know you've been involved in these care priorities on the federal level as well. Another unique thing about that year you mentioned was also when Congress had adopted a piece of policy called the Alzheimer's Accountability Act, which gave Congress and gave the scientists at NIH a direct connection to talk about research funding, which you'll see over those next 4 or 5 years made the process much easier to have the scientists directly telling members of Congress what they need to get the job done, where the research is, and what they need to continue that work. So on that care priority front, I just wanted to mention, you know, ongoing work we've had in terms of opening up Medicare billing codes for care planning, for example, and then currently a priority, multiple priorities we're working on right now with Congress as well. So Chelsea, if you don't mind just going to our current advocacy campaign, I'd love to spend a little bit of time talking about those priorities. So believe it or not, during this pandemic and everything else, we are still staying active on advocacy. Chelsea on our team is going to spend a little bit of time talking about what our experience has been in these unique times. But frankly, we've had really good feedback directly responding to the COVID-19 crisis, both on the federal and state level, working with our elected officials, but staying proactive with what we're trying to do to support families. We launched a campaign a few weeks back with 3 top priorities we've been working on with Congress. Over that time, we've been doing virtual meetings just like this with our members and having advocates and families join us and share their story directly with members. So I'm going to let Chelsea talk about that experience, but I am going to just briefly mention what these priorities look like so we have some context here. The first one being a completely new initiative really focused around elder fraud and abuse. And as we know, especially with this community, how vulnerable to financial, physical, mental abuse. I know just anecdotally, personally, I've had an experience with my aunt this past year where even someone as well connected as I can be at the Alzheimer's Association still had such difficulty navigating those waters. This bill quite simply directs the Department of Justice to really look at Alzheimer's and dementia within a much larger framework to prepare training, resources, and everything to frontline workers to really better detect fraud and abuse. This is a brand new bill we're working on. It's part of this larger campaign, and it's something folks can get involved in today. The second piece is a little bit more wonkier when it comes to policy, but it's critically important. This to do with a Medicare billing code, and which allows families to bill to Medicare for care planning services, which we know is vitally important in under normal circumstances, but especially right now during this pandemic, for families to be able to have a care plan in place to know how to navigate this system when, frankly, folks are really fearful about putting a loved one in long-term care for obvious reasons right now, or going to a hospital. And last but not least, and a really critical priority is relief for charities. Frankly, in my time at this organization, I have not been involved in an initiative like number 3 here, but like everyone else right now, the Alzheimer's Association and other large nonprofits are really getting hit hard by the economic impact of this pandemic. And, you know, because of some technicalities here in terms of the size of these larger nonprofits, we have not been eligible for relief so far. So we've been working with our members to say we'd like to be included in this package and like to be thought of, given the direct impact we have for so many families. So that's the long and short of it. Katie, I'd love to open this up for questions from you on, you know, this experience, and definitely give Chelsea an opportunity to talk about what this campaign's looked like thus far.
That would be great. So Chelsea, what do you see as some of the ways that families or advocates are supporting the current advocacy initiatives during the time of pandemic?
Yeah, that's a great question, Katie. We definitely, as I'm sure everyone on here, have been thinking through what does advocacy look like in our new hopefully temporary virtual world. And so we try to really think about what would that look like with congressional offices. Do they have the capacity right now to address our issues? You know, we of course want to make sure that they have every resource available to, you know, directly deal with some of the most pressing issues like testing and PPE. And but we've actually found that our advocates are very eager to get involved right now. You know, we, as I'm sure everyone listening knows, that we serve a very vulnerable population, whether during a pandemic or not. And, you know, the needs of this population don't stop during COVID-19, and we have to keep making progress. We have a very high risk group that we serve, unfortunately at high risk for COVID as well. So keeping all that in mind, we found a very strong response from our advocates and also from the elected officials and their staff that we have been able to work with in the past few weeks, or maybe now months. So that's been very exciting to see. And yeah, advocacy definitely looks different right now, as Dan talked about, you know, and I'm sure, Katie, you can share some of your experiences as well. You are an amazing advocate. But so instead of maybe meeting in a congressional office, we are targeting a meeting like this, where we're on webcams, using the chat feature, using screen share if we need to, all the things we're doing right now to communicate our message effectively. Along with, you know, we are very lucky that in 2020 we have so many different ways to communicate.
Yeah.
And we can have our advocates send emails and post on their social media. We've even had advocates who have recorded personal videos of themselves talking about why this campaign that Dan just reviewed is important to them personally. So there's a lot of different tools that we have been able to use.
So if somebody, you know, felt inspired and said, you know, this is impacting our family, Alzheimer's disease, FTD is impacting our family, and I want to do something about it, but I have no idea where to start, what would you tell them is the first step? What's the first thing they should do, Chelsea?
I would say the first step would just be to share that with Dan or I.
Call us.
Yeah, how can
Absolutely.
they find you guys? What's the website that they should go to?
So Chelsea can share. We do have a want to learn more slide where it'll have our
Good.
alzmassnh.org/advocacy. But quite simply, I know Chelsea's emails up there, and we can follow up and share. Those will be posted publicly. But that's how we do this. It's public facing. It's also word of mouth, and our advocate community is very much a big family. I mean, we have hundreds and hundreds of advocates, even across the state, and thousands across the country, who have also just gotten to know each other through this work as well. So they communicate directly through social media platforms. And then, to your point, Katie, we work directly with families to sort of work through what that experience has been. I mentioned those 3 priorities earlier. If someone had an experience with a loved one who was taken advantage of financially, that would be a great opportunity to turn that pain and that terrible experience into something positive, and maybe speak to that elder justice bill we're working on now. So we are here. That's what we do. That's our expertise, is really to work through exactly how we can apply these rough experiences into something positive and shaping policy.
Exactly. And so I think the other thing that's interesting too is what I've noticed is that elected officials, of course, they want to hear about what were the struggles that families experienced and what were some of the things that would have helped them. But what I've also noticed is that elected officials also want to hear what worked well. So if having hospice help care for your loved one, if getting support from the Alzheimer's Association, if being able to go to a support group made a difference for you, then they want to hear that as well, so that they know what are the programs that need to continue to get funding because they're making a difference for families. Chelsea, if someone's interested in becoming an advocate, do they have to spend a long time educating themselves about policies or specific information about like how to become an advocate? Do you have to get certified to do something like that?
No, I mean, we get this question a lot, actually. So I think a lot of people wonder this, and you really, I know Dan kind of kicked us off talking about you don't need to have political experience, political knowledge. Same thing for policy. We really try to make our advocacy and policy work accessible. We cannot do this work effectively without advocates. It's through, a lot of research and surveys of congressional offices. It shows that the most effective way for you to, get a lawmaker's attention is really for a constituent to bring attention to it. And they want to know what is important to their district. So we need to make sure we have a voice in their district through their constituents. We try to make sure that, of course, you have any information you need to have before, say, we have a meeting, or even send an email. We do briefings often with our advocates. Right now they look like this. They're virtual and very accessible. Sometimes, in more normal days, they might be a mix of in-person or conference calls. We do trainings, but nothing's, it's very accessible to plug into. We explain everything. We make sure you have all the information you need. And then a lot of our advocates, they might not talk about the policy as much as they will talk about their personal story.
Right.
And that's really key to getting involved is, I'm sure most, if not all of you watching this, whether live or recorded later, have a personal connection and a reason that you want to get involved. And that's really what we need. We need your passion and your story, and just a willingness to be open about those things, and we can take it from there. So that's really all you need to bring to the table.
And Katie, if I may just add, you're looking at your staff team right here for Mass New Hampshire. Everything we do is volunteer led. We have what are called ambassadors, who are volunteers who have worked with Chelsea and I to really work through our policy priorities, tailoring their story appropriately. and then building a personal relationship with a member of Congress over months and years to really move the message about what we're trying to accomplish forward. And this is all volunteer led. So our day to day is very different in the work we do, but we're constantly just working with volunteers and looking for new volunteers to bring in to this, because there's never enough help when it comes to this, and we are always looking. So we definitely encourage folks listening to this to please reach out to us.
And I would like to really encourage our community that even though I know you keep hearing the word Alzheimer's today while we're talking, but that those advocacy events it's critical to have voices from the young onset and the related dementia population. You know, one of the things is when we're talking about services for families in the United States caring for a loved one with dementia, it's important that we take the opportunity to educate our elected officials that it's not just the elderly who are impacted by Alzheimer's disease and related dementias. And in fact, we want them to know what are the related dementias. And you might think, oh my gosh, my loved one has FTD. If I went to an Alzheimer's advocacy day, who would be interested in that? And in 2015, I had the experience of being an advocate, going to Representative Stephen Lynch's office, where I spoke with one of Representative Lynch's staffers. And I told my story about losing my husband to frontal temporal dementia when he was just 33 years old. And when I was done telling my story, that staffer said, my mother received a diagnosis of frontal temporal dementia last year. So I guarantee that that staffer was not going to forget our visit to Representative Lynch's office that day. And I think that's another thing is you don't always have to meet with the senator or the elected official, the legislator, to make your story heard. Staffers are incredibly powerful gatekeepers who want to hear your stories as well.
That's a really good point, Katie. I would say two things I thought of listening to your comments was also persons living with dementia and making sure their voice is heard directly. So many of our advocates are actually living with some form of dementia, and whether they show up on Beacon Hill or to Capitol Hill, we've done some of our best work that way. One of our advocates I think of actually has Lewy body dementia, and him and I spent hour upon hour upon hour just walking to office on Beacon Hill together and sharing his story directly with lawmakers. So there is so many different approaches to this, but everyone has an opportunity and a voice here, and that is crucial. And the point you made on staff as well, you know, Chelsea can speak to that, having worked as a staffer on Beacon Hill. The staff are really the lifeline behind the operation, getting things done. And it's very true that we form some incredible relationships with various political staffers to help get this done.
Yeah.
Yeah, I'll just add to that I think, you know, that's another thing that we often have to make sure our advocates are prepared for, that we won't always be meeting with, whether it's a state or federal elected official. But as you and Dan have pointed out, you know, oftentimes they are the ones to really go in depth on an issue, whether it's healthcare or even sometimes now we're talking about, you know, economic justice right now with the nonprofit relief. So occasionally getting into other topics that affect our population and our work. But I think it's really an opportunity to sit down and often have more time with someone like you did, and you were able to share your story and make that personal connection that I bet you that she or he, whoever the staffer was, haven't forgotten about either. And if it's okay, I'll just share one more slide as well.
Of course.
Just hitting on some of the questions you're bringing up, Katie, around, you know, kind of what is an advocate look like, just to give some context for people about, you know, if you're an advocate, even if you call Dan and I and say, I want to be an advocate, what happens next? Of course, we talk through our work similar to this of what does the policy look like? But here's some of the action items after that you might be able to partake in depending on your availability and what you're interested in. We definitely try to tailor our advocacy activities to what fits best for each advocate. Some advocates are very active on social media and are totally game to record a video of themselves and post it everywhere. Some are very comfortable making phone calls or sending emails. And as Dan pointed out, some of our lead volunteers for our congressional officers that we refer to as ambassadors, some of them have been doing that for years, and they get to a point where they're comfortable making the meeting request ask or really leading a meeting. So it all really depends on your interests and what you're comfortable with, but we try to make sure this is accessible. I'm sure many people watching this know that if you're a caregiver, maybe you can't attend a meeting. Maybe
Right.
Meeting virtually is best for you because your schedule, or maybe you are looking for more to get involved. Usually in normal times, we have a big conference in DC, which is something you've referred to. Hopefully we'll get back there eventually, but there's all different opportunities and ways to get involved. So just wanted people to know that you don't have to be committing to meeting with Congress all the time and going to DC. We have ways for you to get involved from your house, your computer, and also in Massachusetts policy as well.
Yeah, and I just really want to second that if you think that if you're listening and you think that you might even have the smallest interest, reach out to sign up to receive the regular updates over email. And you don't have to start by showing up and sharing your story. Sometimes sharing your story is a really emotional experience that's too emotional to think about doing in person. You can start with baby steps. And the best thing of all is that these folks, Dan and Chelsea and other advocates who are experienced, they'll be there to support you, to help you feel comfortable, to let you take things one step at a time. I have never met anyone who's connected with advocacy who felt pushed to share more than they were comfortable with or was asked to do something that they weren't prepared for. So it's really an opportunity to learn and be part of a larger effort, and that can be very healing, to see that, hey, you know what, Alzheimer's thinks that it has all this control, but this is a way that we can take the power back by raising our voices. It can really be helpful.
Yeah, I think that's a great point, Katie. And, when we talk to potential advocates or people who are interested, definitely always want them to feel comfortable, never pushed into telling your story. We want this to be a healing experience. And another thing that I think is kind of a hard thing to put on a slide about our advocacy work, but for a lot of our advocates, I think they find community within one another. And I think that can be healing as well. I think it's hard sometimes, maybe you have friends or family who don't understand what you're going through. And, we all know no story, no one's dementia looks the same.
Right.
No one's caregiver story or family story looks the same, but there is this kind of bond formed. And I think that's a really nice thing about getting involved in our advocacy program, that it's not just about working with Dan and I or working with officials. You're working with other advocates, whether in these meetings or just through our internal volunteer meetings. You really get to meet a lot of people who unfortunately get it and get to some degree maybe what you're going through or have gone through.
I've actually referred families, so several families who've started out and they're kind of in the early stages, and they'll say to me, Katie, I don't want to go to a support group, or I tried a support group and it was really talking to people where I didn't feel connected. And I'll say, well, have you thought about joining the advocacy groups for that exact reason. And then they've come back and said, oh yeah, I met this other family and they're a lot like us. And so it is a way to get support. I always say we don't have a cure for Alzheimer's and related dementia today, but we have a cure right now for the isolation and loneliness that can come along with a diagnosis. And being connected with your amazing advocacy program is one of the ways that people can fight back against that isolation.
Absolutely. And Katie, I know we have a decent amount of time left, and we mainly highlighted our federal work, but I know you probably have a bunch of questions for us still, and happy to keep this a conversation. But just wanted to make the point that we are very active on state level public policy, and that's actually where we get a lot of our priorities around care for those with dementia accomplished, whether it be protocols and regulation in long-term care facilities, or more recently, in Massachusetts, for example, a law that required all clinicians to have training in Alzheimer's and dementia to better detect and diagnose in the first place. So we are, it's definitely a fight on two fronts, and a big portion of that happens on the state level, not only in Massachusetts and New Hampshire, but in state capitals across the country. So I just wanted to make that more directly known to everyone with the work we do. And as Chelsea mentioned, no advocate is exactly the same as well. We have some folks who only want to show up and do work on Beacon Hill, and that's okay. We have other folks who want to do it all. We have other folks who only want to work with one member of Congress. So we can definitely tailor this approach, but want to make sure it was known that we definitely do work across the spectrum here politically.
Absolutely. And so one of the things that I'm really proud of, and when we get to participate in national forums, it's really nice to say that you're from Massachusetts, because we are a state that is a leader in Alzheimer's and related dementia policy. And I was wondering, Dan, could you explain a little bit about the landmark legislation, House Bill 4116, an act relative to Alzheimer's and related dementias in the Commonwealth? And why is that a big deal? What was it about that made us, leaders in the nation?
Sure. Yeah, this was really exciting. And it was a game changer for a number of reasons. I think I would start by looking at it, and, especially right now, I keep referencing COVID-19, but there's a lot of conversation about public health right now. And the work of the association and other partners as well has really been making sure Alzheimer's and dementia is seen through a public health lens when it comes to an integrated government approach, not just that direct care and that direct solution, which we also do, which is so important for families. But this more integrated public health approach and government response is really the only way we're going to tackle this when we look at the numbers. So what this bill really sought to do was a few different things. The largest problems, just to start with, that were identified were a lack of diagnosis for Alzheimer's and various forms of dementia as a whole. I would always use the stat, 50% of those with Alzheimer's or dementia are not diagnosed. Of those diagnosed, less than 50% are aware of their diagnosis in the first place. That was really the entire sort of initial groundwork laid for this bill to say, how do we fix this? What's the solution to that? So we got to work on this. This kind of started by, we toured Massachusetts, we met with advocates, and we did legislative breakfasts and town hall events all over Massachusetts. And those were the common stories and themes we kept hearing. It was so hard to find a diagnosis. We didn't know where to turn. Our clinicians, not that they're bad people or they don't know what's going on, but in primary care, they're not equipped to understand what's happening here. Another thing we kept hearing about, the experience with our loved ones with dementia in a hospital setting was so difficult. Um, and of course, cost, just hearing about cost and what this looks like. So we really kept hearing this problem set, and we did this across the state, and then we also brought it to Beacon Hill, where we worked with some key lawmakers who said, we keep hearing about Alzheimer's and dementia. We keep hearing about these problems around diagnosis and in hospital settings. We need to do something about this. So it actually got to the point where the legislature convened an oversight hearing and invited, we had a full, must have been 6 to 8 hour day of just panelists and experts and researchers and doctors, nurses talking about this and what to do. And from there, House Bill 4116 was formed. And it is in no way perfect. It's no way a silver bullet for any of this work, but it's a huge step forward in Massachusetts to now have all these clinicians required by law to be trained in Alzheimer's and dementia and how to interact and understand, as well as all hospitals required to have operational plans in place to be able to better handle and manage folks with dementia when they come to a hospital setting, because we know the downturn that can happen after that. Those are just a few aspects highlighted from this law, but this was a really big step in transforming sort of how healthcare delivery thinks about and shows up to dementia. And that was really what we were trying to do. And there's so much more work to be done, but that bill has since been replicated in neighboring states and as well as across the country. So much more work to be done there, but really a crucial step forward. And as we've seen with really landmark issues across the country when it comes to public policy, whether it be things like gay marriage, for example, those start in state legislatures, policies formed, accomplished, and then it keeps happening to reach a larger aspect. So we're very focused on what we do on the state level.
Yeah, and Chelsea, I think you've really seen, just as Dan's talking about, state policy can grow to inform national movements. But I would also say that one family's story can inspire others to share their stories, to build to the point where you have enough voices to inspire that policy. And could you talk about some of the elements, like what are the things that families share that really make legislators sit up and listen?
Totally. I think, it depends on every individual and family, but I think well, actually, I can pull from something that you've done, Katie, that is powerful, and it doesn't work for every setting, but in some meetings, our advocates will share pictures of their loved one. I also think that, Dan's point about people with dementia advocating really gets elected officials' attention. Some of more stories that maybe people haven't thought about situations like that happening, or so for example, our younger onset advocates, I think people, Alzheimer's and other dementia does affect a lot of our elderly population, which is something that we really need them to pay attention to, but we don't want them to forget either and not highlight that there are a lot of families who go through this very unfortunately at a much younger age. So I think some of those things stand out, but I really think just an openness and a willingness to even be that vulnerable, whatever your story is. It doesn't have to be the most unique story for it to stand out. I think that just sharing something very personal stands out to our legislators, and we've definitely seen that our lawmakers do care. I mean, Dan and I had a meeting just yesterday. It was a virtual congressional meeting with Congressman Keating about this new campaign, and the congressman actually called Dan and I back separately after, just to talk more, and also to really convey that he really appreciated hearing from the advocates and the personal comments and cares about this population. So we have seen that our advocacy does really have an effect on our lawmakers.
And it's
And
so,
Katie, if I can just add one thing, to the story point, our advocates have developed really good personal relationships with lawmakers. Whether it's on the state level, State Representative Danielle Gregoire, who really helped lead the charge on that bill, became like a leader for our advocates almost, with just the work she continued to do on this issue and directly interacting with these volunteers. Another example I use all the time because it's really compelling is another one of our advocates shared his story so frequently and directly with Senator Elizabeth Warren. She actually took his story and put it into her book a number of years ago, even before a presidential run. But it just goes to show how far a simple step of reaching out to becoming an advocate can go for folks.
well, and to also think about, so the point that you both have just made is how important those voices are. And for many of our loved ones living with a diagnosis, when they receive that diagnosis, it's not their choice to receive a diagnosis. And also during that time, things could be taken away from them. Like maybe they're not able to work at the job they did before or do some of the things they used to be able to do. And taking on this role of advocate can be a choice. It can be a way to empower yourself and to get something back, to gain something, to know that you're contributing at a time in your life where you might feel like, I don't know how I'm making an impact. And so to really think about that, if you have been diagnosed with Alzheimer's disease, frontal temporal dementia, or related disorder, that we want to hear from you and that your voice is important, and you can connect with Chelsea and Dan through the website. We have alzmassnh.org/advocacy. And to just really know that they're waiting to hear from you. Yeah.
Yeah, and I'll just say, Katie, one last point. With advocacy work, you don't just have the opportunity to affect maybe one individual or one family, but we, potentially have the opportunity to affect for the masses who maybe due to their situation can't be out and advocating. So that's something I think that is hopeful and hopefully inspires people to, if you can and have some time to get involved, that we can really change Alzheimer's and other dementia policy for other people.
Chelsea, that's beautiful. And Dan, as we're leaving today, I want everyone to know I'm wearing both my pins today for the FTD unit and the Alzheimer's Association. Could you guys talk about the meaning of the pin? Because I find that very inspiring. What does the logo represent?
Yeah, absolutely. I'm really happy you asked that question. I frankly have not been able to put a suit on for a couple months, so I haven't been wearing my lapel pin. But had I been wearing a suit, I would definitely have the pin on it because I get so many questions about it. I still don't know who came up with this logo. I've been 4 years trying to figure it out.
No.
That being said, it's if you look at it, it represents the brain and the beaker. Obviously, the work of the association through our advocacy, public policy, research, care, and support, supporting loved ones with an issue that, of course, affects the brain, but also the reverse of that being the beaker, representing the fight we do on advocacy and fundraising and everything to support the science. So I love that you asked that question. I think it's too unique and cool of a logo. And I know we're probably close for time here, but I just would also just kind of like to have some closing words on, we definitely didn't cover everything here. There's so much policy happening and it's constantly evolving too. So while we come to advocates with some prepared platforms and pieces of legislation we're working on, the reverse side of that is it's also very informed from what we hear, to the point Katie made. So please continue to reach out and let us know what you're experiencing, because as we know, healthcare is such a dynamic and difficult situation, and there's constantly issues coming up in this space that we're trying to work on. It's a marathon, not a sprint. We're making really good progress on this front, and we couldn't do it without our volunteers and advocates behind this.
You guys are awesome. Thank you so much for giving so much of your precious time today. And thank you for the work that you do to help our families raise their voices. It's so important, and I'm incredibly thankful that you both are in your roles at the Alzheimer's Association. So thank you for that.
Thanks, Katie. Really appreciate it.
Thank you for everything you do, Katie. We
Of
really
course.
appreciate
Of course. Well, I hope you guys will stay healthy and safe while you're pounding the virtual pavement for Alzheimer's and related dementia policy and advocacy work. I hope that you have new advocates reach out to you because of this. And thank you so much.
Thanks, Katie. Take care.
All right. Have a great day. Bye.